Okay. Hi, I'm Carlos Rivera.
I'm CJ Thompson.
I'm Jillian Freese.
And I'm Jordan Wills.
I'm Madison Dewar. We are the professional athletic training students at the University of South Carolina. And in this video, we will be demonstrating cold water immersion.
Boom.
All right, today I'm going to be demonstrating how you perform a cold water immersion and what that situation kind of looks like. So first, you're going to be out and you're going to have an athlete go down. So you're going to come up to your athlete and you're going to perform your primary assessment to figure out what's going on. So, excuse me, are you okay? Are you okay? In a situation like this, you would suspect exertional heat stroke. Signs and symptoms of that include CNS dysfunction, nausea, dizziness, confusion, anything of the sorts. Because we think that it could be any sort of exertional heat illness, we will also take rectal thermometry. Once you suspect a possible exertional heat stroke, you would activate your EAP, which involves alerting someone to call 911 and getting emergency equipment such as the AED in case your patient goes into possible cardiac arrest. So in this situation, I would have my assistant with me, and because we suspect a possible exertional heat illness, we want to take core temperature, and best practice to do that is with rectal thermometry. So you would do this modestly, and you would have some sort of cover up, but what you're going to do is you're going to roll your athlete on their side. In this scenario, you would remove clothing appropriately, you would cover, you can use people as barriers if you have a towel with you, whatever it takes to continue and hold modesty. In this case, we're just going to tuck it into his pant. Traditionally, rectal thermometer, the way it works is you insert it about 6 inches to get the best reading. So now that we have the rectal thermometer set up, if we obtain a reading of 105 degrees or over, that is an indication of exertional heat stroke. So now what we have to do is roll him back over, and I'm going to call people over to assist me, and we will begin cold water immersion. So, Jillian, I'm going to have you take care of the rectal thermometer, so just keep it on your persons at all times. Okay, all right, we're going to roll him back over. All right. Can I have Carlos, Jordan, and CJ come help me? We are going to perform a lift to then get him into the tub. So Carlos, if I can have you on his right shoulder, I'm going to stay on his left. CJ, if I can have you on his left legs, and Jordan on his right. All right, so we're going to lift him up to a sitting position. And then Carlos, you and I are going to have his arms around our shoulders. Okay, and then we're gonna lift, and on the count of 3, we're gonna lift him, and we're gonna walk him over to the tub. Everybody understand? Yes. Okay, 1, 2, 3, lift. All right, 1, 2, 3, down. Okay, here, we're gonna take a towel, and we're gonna wrap it under his arms in order to keep his head and neck above the water level. We will have someone remain with him, in this case Jillian, as she's in charge of rectal thermometry. She will continue to assess vital signs. So she will take blood pressure, continue to monitor his pulse. Okay, so once we get them in the tub, we want to make sure that their core is submerged in water and ice. So if we could try and shift him so that his core is more so in the tub, and we keep his head and neck above water level. Okay, now we would begin putting ice in the tub, as it should have been previously filled with water. We want to make sure it's cooled. The water is cooled to 15 degrees Celsius or 60 degrees Fahrenheit in order to cool the patient down. We would also continue to monitor vital signs, and while that's happening, circulate the water in order to ensure that the patient is being properly cooled. So once you have a reading on your rectal thermometer of 102 degrees Fahrenheit or lower, or if you are not able to insert the rectal thermometer and you circulate water and ice for the patient for 15 to 20 minutes, the patient can now be taken out of the cold tub and moved to a cool shaded area. Do your best to dry the patient off, and if necessary, remove any excess clothing that is holding onto any water or ice. And continue to monitor vital signs, and then EMS will have arrived and then transport.